Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, everybody. Welcome. So today I have the pleasure of discussing an important episode with Dr. Carol Chu-Peralta. She is a clinical psychologist and the founder of Center for Resiliency.
Yes.
Dr.
Good
Carol,
morning. Good morning. Thank you for having me.
Thank you for being here. So clinical psychology, that is an achievement.
Thank you. Thank you.
Is there anything specifically that led you down the path of pursuing a career in clinical psychology? Anything specific?
Yes. So funny story, just a small, kind of preface to how I even ended up in clinical psychology. I was actually a Spanish major in undergraduate school. And pretty soon into my first semester, I was like, I'm not so sure that I necessarily see this as my future. I think I had just kind of taken it as the easy major because it was my native language. And I was like, let me just do it. So anyway, so then my friend was like, well, I'm going to go and declare my major. It's psychology. And I was like, well, let me give it a try. Just kind of on a whim. And then fast forward, I really started to enjoy learning about humans and about how they interact, and then about how our brains develop and how all of that ends up influencing who we end up being as adults, how we end up anticipating the world and understanding ourselves. And then when I ended up going to graduate school for my doctorate, I started learning about trauma and about trauma psychology and all of the different forms of trauma that exist. And it really made me become curious about my own parents' history because they are not originally from the United States. And so I started asking them, well, what was your migration history like? What's that story like? And as they started sharing it with me, I think just naturally this marriage between learning about my own family history and understanding that I can try to contribute to the betterment of people's lives who have experienced trauma just really naturally unfolded. So that's really, I think, how my future into clinical psychology came to birth, and then how it just continued to maintain. And, ever since then, frankly, since the first case I was ever assigned as a graduate student, it was a trauma case, and I never looked back.
Wow. So trauma is heavy.
Mm-hmm.
It's something that people don't readily talk about and are comfortable talking about because of the sheer vulnerability and strength that takes to really spill the beans.
Yep.
So how was that, working? First of all, I commend you because working with family, that their trauma is kind of your trauma too. How did it feel at the very beginning stages working with trauma that was so close to the heart?
I don't know that I thankfully ever really immediately interpreted it as, oh my gosh, I am the direct victim of trauma and I have that unhealed, and that is not letting me sleep at night when I'm hearing my patients' narratives.
Okay.
So I'm very thankful for that and being very aware of that.
Right.
And I think if anything, I really did have the luxury of when I heard my parents' stories, it overlapped a lot with the story of my first trauma patient that I ever had. And in my mind, I think it immediately just translated into, okay, well, this is the future generation that's still experiencing traumas that previous generations have experienced. So how can I start to help break the cycle? And I think in me, it just kind of felt like if I could contribute on this micro level, one-on-one to help change and improve somebody's life, that ultimately will have this trickling effect and hopefully also start to have impact on a larger scale at the macro level. So I think that's always really been my primary perspective in the driver's seat. And that's perhaps what I still frankly have that keeps fueling my passion to keep working with trauma survivors. I have the luxury of, I was not the direct victim of the traumas that my parents have experienced. And at the same time, I've learned so much from it.
Yeah.
And I want to really help people who are still going through what they had to go through.
That's so beautiful. When it comes to resiliency, the Center for Resiliency, if somebody, people throw out that word a lot, and it is used in everyday, say, in a daily, not daily for some people, but commonly used in the vocabulary of, especially in the healthcare space. What would you describe resiliency as when it comes to dealing with trauma, right? So what makes a person resilient?
It's a great question. Resilience and resiliency, it's this variable that cannot be cleanly measured or studied in the research, right? And a lot of the work that we do in terms of therapy and in terms of psychological evaluations and helping people heal and move forward in their life is driven by science, of course. So, the irony to this is we don't have a perfect equation for how to study resilience and resiliency. However, there has been research done on it. And so what we do know about it, even though it's not like this perfect, like as if we could, draw blood work on someone and determine their level of resiliency so perfectly that way, like we might be able to, measure someone's iron level or someone's, how well someone's immune functioning is. But what we do know from the research on it is that some people, people have varying levels of it. And what happens whenever somebody is going through trauma or has gone through trauma, that factor of resiliency is what helps them persevere either through it or afterwards whenever they are still navigating some of their trauma responses, such that it gives them hope, such that it gives them motivation to move forward, such that it allows them to have this cognitive flexibility of being able to see things from a different perspective in a way that perhaps might be more helpful to them. So, I would dare to say that resiliency really is a helpful factor for people who are healing from trauma, and is also a factor that has so many other factors that contribute to it.
Right.
So that's perhaps like the best way that I could describe it.
I think that was a great description of it. And you mentioned how people respond to things after trauma. Just a little bit on experiences, especially traumatic experiences, how they shape our lives, personalities, and how we view things and also respond to things. What do you say to a person or a set of people who have this mindset that, hey, I've been through so much in my life, it hasn't changed me?
I would dare to say, on the one hand, I have to respect, obviously, what their perspective is and what their belief system is.
Right.
And I would try to engage them in a conversation, right? And the point of a conversation with someone is never to convince them of our perspective, right? So, although we might have perhaps this urgency or this desire of persuasion when we're having a conversation with someone, if that is our objective, whether it's conscious or unconscious, that conversation is going to fall flat quite quickly, right? And if you really want to help someone change the way that they are living life so that it could be in a way that's more satisfying to them, then you want to be able to invite their perspectives into the conversation too in a very respectful manner. So it might sound like me saying to someone, I get it, you're right. You probably have been having your belief system, your values, your ideologies, your behaviors, your lifestyle for a lifetime. And it has helped you really survive. It's helped you maybe even thrive in life. It's really helped you get to the place where you are today. And sometimes, depending on where we are in our life, what life stage we're at, sometimes those ideologies, those values, those belief systems shift because they're no longer helpful. They're no longer necessary for us to really survive the situation. And at the end of the day, all of us, or at least this is my perspective, really all of us are a product of our past, environments and our upbringing and our genetics. So they're right to some extent. That's the truth. And I wonder how, open they would be to just having a conversation that might allow them to hear a different perspective on it.
Absolutely. And you said something incredible in that statement that, for survival. So there's so much that we do unconsciously to survive,
For
right?
sure.
Code switching is one of those things, blending in, even, people pass, as other races just to survive or not to stick out. So, and these actions sometimes deliberate, sometimes are subconscious, but it does either come from our experience, being shaped by experience, or wanting a different experience. So there's usually something there if somebody's willing to engage in the conversation, like you said, is not for me to project and say,
Right.
oh no, you can't say that is not true. I'm
Right.
sure you're affected. That's that person's truth at that
Right.
time, right? So it may not be the whole truth, but it's their truth. And
Absolutely.
respecting it goes a long way.
Right.
What would you say to the other aspect of projecting? When a person projects either their denial or survivability on somebody else who has experienced trauma and is actively crying out for help. I'm talking about the get over it kind of a statement. Don't let that affect you. Oh, it's nothing.
Yep. And we hear that all the time, by the way, from our patients, like, my significant other or this other person in my life essentially has the conceptualization of pull yourself up by your bootstraps and just go on, just get over it. Right. And again, I know that it takes perhaps a little bit more, some self-control and some awareness and a lot of patience for someone to be able to understand that they don't have to personalize that person's belief system on how to heal from trauma, and that is a reflection of that person's belief system, and that you have the agency, the choice to not adopt it. Right. Similarly, like, for example, whenever we are growing up, there is this beautiful research on the development of identity. And what it's shown us is that as let's say, like between the ages of about 12 till about young adulthood, where identity really is starting to be at the forefront of development, the more that we are exposed to other people, the more that our beliefs, ideologies, and values are challenged, that are the ones that we've grown up with, right? So what ends up happening is that either we could enter into this stage of what's called foreclosure, and we'll just continue to have the same beliefs and values and ideologies that we grew up with within our family, within our nuclear family, right? And we don't even consider any other options that exist out there, right? And so for the trauma survivor who's hearing someone say to them, just get over it, or just pull yourself up by your bootstraps, and they're absorbing and adopting that belief system and thereby feeling really ashamed that they haven't healed yet by the definition of this other person's belief system, they might be in that foreclosure stage, right? So that's perhaps something to work on, right? Or we have other people, when they're developing their identity, they might be at another stage of identity development that's called moratorium, which is when they're in the process of, now that they've been exposed through other settings like school, work, etc., they've been exposed to these other ideologies and belief systems that they're sort of like questioning, not in a bad way, but just in a like typical developmental way. Wait a minute, recognizing, oh, this is how I grew up seeing the world. This is how I grew up understanding me and other people. But these other perspectives exist. Which one really resonates with me? Is it a mixture of them? Do I let go of some previous ones? Do I adopt new ones? And so for our trauma survivors, that is a healthy stage process for them to really go through. So the encouragement there is, hold on, can we draw a line and recognize where that person's identity, that person who's telling you just get over it, where that person's identity ends and where does yours begin, so that you understand, if it doesn't resonate with you, if it doesn't feel good, settle well, what the advice that they're giving you, then it's okay for you to not necessarily just immediately adopt it as your own healing process or perspective on how you should be healing.
Wow. That was a lot and a lot of good stuff said.
It is. It
Um,
is. Healing is not straightforward. Healing's not.
oh my goodness. Say that again.
Healing is just not straightforward. It just isn't. It doesn't happen in a vacuum. It's just not.
Healing is the roughest thing I've ever done in my life.
I believe it.
Healing is rough. It is not linear, like you said. It very much is very ebby and very flowy. It's very mountain and valley-ish.
Yes.
And in those valleys, you have to be conscious
Mm-hmm.
of everything. Be conscious of what is coming in, the stimuli is coming in. Be conscious of how you're receiving those stimuli. Be conscious of the reaction to those stimuli and knowing when to cut the cord
Yes.
so that you're not reverting to, square zero. So it is a process, it's a very conscious process for anybody that has embarked on that journey. I don't know. Maybe am I scaring people? I'm not scaring anybody, please.
No, these are raw, true stories. I mean, here's the reality of it, right? Anybody who's listening to you right now, there's bound to be at least one person that's like, yes, that's probably been my process too.
Healing is rough. It is so worth it, though. It is so, so, so worth it. Just being in a space where you're okay with your feelings and sit with those feelings, things that you would have naturally just over. It's so refreshing, and it takes you betting on yourself. And please, if you're listening to this and you've been contemplating going on a healing journey, wherever you start, prayer, meditation, whatever it is, start somewhere, but seek help where you can talk to somebody who does not have room for that emotional investment, personal and emotional investment.
Yes, that's such a beautiful term, investment. You are absolutely spot on when that's what you call it. It is an investment.
It is. And so let's touch on a bit of something a little touchy. And I know most people shy away from this, but it's something that it is very rampant, and it's sad that it's so rampant in a society, in a world today. When it comes to molestation. In your experience and your work, do you see that any kind of assault in that regard? Do you see like an intensity in the healing process in a child who's now an adult compared to something happening in adulthood? Because you talked about the ages of 12 through maybe about 16, 17, when a child is focused on curating the identity. And, through Piaget, Erik Erikson, we have all those stages of development. And we do know that if any of those stages of development are arrested at any point, he throws off, satisfying that stage. With adults who've experienced any kind of trauma, especially that as a child, how difficult is that journey for them in your experience, as opposed to, say, an adult or young lady or young man who experienced the same as an adult that, slightly had the cognitive ability to process things?
Right. I think that's such a valuable question to ask, because I think it's probably on more minds than people are comfortable speaking about or even asking that question. In all honesty, I would actually encourage people to think about it this way. While we might be thinking formally as an adult being somebody who is more well-developed or who is more developed cognitively than a child, the truth is that, unfortunately, sometimes that doesn't hold true, meaning we have some adults who experience, let's say, sexual assault for the first time in their adulthood, and that's not necessarily the first form of trauma that they've experienced. That might be that first time of that type of trauma that they've experienced in adulthood. But what we find anecdotally, and also based on the ACEs study, is that people, by the time that they're of age 18, have experienced more than one trauma already in their life. And so what happens whenever we experience trauma is that it's very much so what you were saying. The cognitive, emotional growth can oftentimes be stunted at that period in which that person experienced that trauma, be it physical assault, sexual assault, emotional abuse, the other forms of traumas that exist, right? Migration trauma. And so while, let's say I might have an adult who's calling in for treatment saying, I don't know, 40 years old. I, recently experienced a sexual assault experience. I'd love treatment for it. Again, if whenever we're collecting their history, we're beginning to learn, oh, wait, there's been other traumas. Whenever we experience a trauma and that those trauma responses remain unhealed, what ends up happening is that we might not have necessarily enough internal resources, like internal coping abilities that are available to us as adults having experienced a trauma. So we're not necessarily navigating or responding to that adulthood trauma the way that perhaps people would, quote unquote, expect us to because we're adults. So that's sort of like the caveat that I just want to add to it. Now, with that being said, when we're children, we just inherently have less resources available to us internally because on the one hand, you're right, cognitively, we are not perceiving the world the same way we would as your average adult would, let's say, right? So what that means is that we have a lot more trust inherently, and we see things in a lot more black and white type of way. So we see it as like, let's say there's an adult in my life that has molested me. I'm seeing it as, wait a minute, very black and white. Like that's the person that should be taking care of me and protecting me. So if they're doing this to me, maybe that is also a form of them taking care of me. Or now I'm very confused because I'm not sure that this is necessarily what they should be doing, but then I can't say anything. There's a lot of confusion that comes along with it. And again, because they don't have enough internal coping skills or resources available to them, they might not navigate their trauma responses necessarily as well as, let's say, an adult who has experienced trauma for the first time in their adult life, who has already had like a lifetime of experience of being able to build more coping skills available to them.
So what should the adult in a child's life look for to identify? Because you did, mention something like, is this part of it? I don't think it is. I'm confused. I shouldn't say anything. What is something that we caretakers can look out for in children to identify if anything of sort has taken place? Because it is studied, and you do know this because this is your area of expertise, that most assault on children, sexual assault on children, usually are not done by strangers. They're done
Right.
by close people that are trusted to be custodial caregivers, right? So what should other caregivers do to identify, one, something is off, right?
Mm-hmm.
And then two, once a child trusts them enough to communicate this, what should be the logical steps taken? Because I'm saying this because there's always a tendency to protect the perpetrator.
I hear you. Yes. And I have definitely experienced that in a lot of cases, unfortunately. And anyway, that could be like a whole other discussion. I completely hear you on that. So, but to answer your question, yeah, how many hours do we have? But to answer your question about being able to identify in our children whether or not they have been victimized, the first step is, in a world where we are all always so busy, I invite parents or caretakers to really slow down long enough for you to really see your child or the child that you are responsible for. And what I mean by that is noticing any changes, subtle changes that you see in your child. Is your child becoming more withdrawn? Do you see your child starting to develop anxiety, whether it's going out, whether it's talking to people? Do you see your child is maybe going in the opposite direction, becoming a lot more behaviorally what's called dysregulated, meaning they're causing a lot of quote unquote trouble at school or trouble at home. They're becoming a lot more what's labeled as defiant, but really, I say that very non-judgmentally because the truth is defiance has a core, and it's not typically because the child is choosing to go against you, right? Like that's not their objective. So starting to notice any subtle changes in your child. And the only way that we can notice those subtle changes in our child if we're really aware of who our child is beforehand, right? So, I'm not saying this to guilt trip any parent by any means. Listen, I'm a parent myself. And like I said, we live in a very busy world. I get it, where we're getting pulled in every direction. But maybe today's the day that we start to become a little bit more aware of, you know what? When my child comes home today or comes back to visit me over the break, I'm going to make an effort to drop what I'm doing for the first 5 minutes that they enter through that door. And I'm going to really look at them and ask them how their day was and really intentionally pay attention, because that's the only way that we're really going to start to pick up on any signs with our children, especially, if they're getting distracted at school and they never used to be that type of student. So again, subtle changes is what we're looking for there, really. And then in terms of you asking your child or acknowledging to your child that you really appreciate them trusting you enough to be able to share that with them. If your first response to them is something along those lines, and also acknowledging to them that they deserve to have been protected, that they deserve to have only the best really come their way, and that you communicate your true feelings about how you feel about them being victimized, meaning some sense of empathy is what they're feeling from you in your communication. That initial response, for your child to hear that, goes a long way in terms of helping their healing process, right? It really does kickstart the healing process in a very effective way versus any other response that you could give that's less favorable, that ends up having your child walk away feeling, I shouldn't have said anything. I feel so guilty. I now am breaking up my family. I asked for this, which are oftentimes common thoughts and feelings that these child victims end up having, these child trauma survivors. So let's just be mindful, I would dare to say, about our initial response to them.
Yeah, that is very important. That initial response is golden. Anger is not it. Blaming is not it. Why didn't you say something earlier is definitely not it.
Right. Absolutely not. And here's the truth, though. Truth be told, again, I completely understand if every single parent whose child has just come to them and shared this with them is feeling or is thinking any of those things, because logically it makes sense that those are some of the things that you're thinking. However, what you are thinking and what you are feeling is not necessarily what's going to be the most helpful to your child in helping them heal.
Yeah, but Liz, don't say anything. Just hug and say, you know what? Thank you. Let me process it. That helps. And, as parents, that's the last, our children hurting is the last thing we want to even entertain.
Yes.
Right?
True story.
It's such a hard pill to swallow, As much as we know the world is not full of rainbows and butterflies, for our children, yes, it is filled with rainbows and butterflies.
I know.
I dare you to do anything to that butterfly. So
I know. Don't you dare touch it. Get away from my kid's butterfly. I'm so with you.
And sometimes, the reaction is not, this is why, taking personal inventory is very important. And I had to learn this, I had to learn this for myself, and understanding that kids feel, and they feel more intently when it comes from a parent.
Yes.
Or loved one, or guardian, or whoever you are to a child. So as intense as emotion might be, kind of like, what am I feeling in my body right now? It helps.
Yes. Yes. You also, by the way, said something that's so key. You said, if you, to all the caretakers who are first, hearing the child divulge something to them, if you don't have the words, if you don't even know verbally what to respond, a hug goes such a long way. And you're absolutely right, because you can use the skill of co-regulation. Like when we have our newborns for the first time, you nurses tell us, like, hold your child skin to skin so that you can start to produce the milk, so that you can start to help your child feel safe, who's now brand new into this world and is not accustomed to, the cold air, going across their little teeny tiny backs. That co-regulation skill is so true, even for us as adults. A hug goes such a long way in terms of helping their little nervous systems heal, because they feel our empathy and our safety transferring onto them. So yes, you are 1,000% right.
Thank you.
It's true.
So please hug. Hugs are invaluable. Just give a hug. When you're upset, just hug it out. Going back to trauma, because, we've had quite a bit of time of talking about, we've been talking about trauma the whole time, actually.
That's okay. Sometimes it needs to be talked about.
I love it. So, going back to doing this work, what is the one thing that you say has either surprised you or not surprised you, but has been expected on this journey? What were the kinds of things that, I guess we do have surprise? Let's start with the surprise and the expectation.
I think one thing that I didn't know to anticipate was how long the healing journey can take, because it's really much more complicated, I would dare to say, and not because the person themselves is like this complicated puzzle, but because trauma in itself isn't, again, just like this one very straightforward variable. It's not, I compare it like, for example, my trauma cases versus, let's say somebody's coming in with like a more straightforward, like driving phobia.
Right.
I can see more immediate changes that will be long lasting when I'm treating someone that has, let's say, a driving phobia, where I can start to see them graduating from treatment within just a few weeks, versus my trauma survivors, because there's so much that comes in with the umbrella term of trauma. So I think that's perhaps the one thing that early on in my career, it really did surprise me. I was like, oh, wait a minute, this really is different than my other cases that I'm learning to treat.
Yeah, healing is lifelong.
Yes.
I've come to find that out, and I'm happy that it is lifelong, and it takes a person to understand what those trigger points are.
Yeah.
Once you understand them, you recognize them, you know how to navigate them so they don't trigger you as maybe you've done in the past. So it's a lifelong learning experience, one that is worth it.
Yeah.
So for everybody listening to us have this conversation, and there's many more things that you and I discussed before jumping on this call that, we can talk about, with people engaging. We would love for all of you to engage, please.
Yes.
How can they find you, Dr. Carol? And, if somebody's not in the same geographical area as you are, is there a way that they can also still reach out and want to learn from you?
Yeah, absolutely. I would dare to say, there's probably like two categories of people that might be right now listening in. The first category of people might be listening to us and they're like, you know what, I'm ready. I'm ready to start my trauma healing journey. Let's get to it. In which case I would invite them to call or to check out our website, which is www.centerforresiliency.com. We're located in Northern Jersey, and we can see people in Jersey at our actual, brick and mortar building, or we can also see people from New York because we're right on the border, luckily, of Rockland County. I'm also PsyPAC certified, so I could see people across several states through telehealth, which is really beautiful. But for people, let's say they're in another category and they're like, let me kind of just learn a little bit more about this first before I commit. In which case, just follow us on social media, because we are posting on there on a weekly basis. The way that I like to say it is free information because this is really like, where my passion is. And I love to be able to give as much information as possible so that people could really feel empowered to make their own decisions in their life. So you could follow us either on Instagram or on Facebook. We are at Center for Resiliency NJ. So either one.
Beautiful. We'll also make all that information available in the show notes so you can click in and find all these resources, the website, social media handle, all of those beautiful things. So Dr. Carol, any golden nugget you're willing to leave us with?
If I could leave you with a golden nugget, it would be that the first step to being able to really break the cycle of generational trauma or of any trauma that you might have gone through that's leading to behaviors or thoughts that you no longer want to hold on to is really becoming more aware of what they even are. So kind of maybe even work backwards. Like, what are the behaviors and thoughts and emotions that I would ideally like to have on most days than not? And then working backwards to identify, do I have any of those behaviors or thoughts already in my life? And if I don't, let me try to figure out which are the ones that I want to start changing. And then the next step would be seeing if you could reach out, to a professional or to someone that you trust so that they could help to teach you how to start to actually tangibly make those changes. So that might be the little golden nugget that I leave.
I love it. I love it. Acknowledge it. At first, accept there's a problem.
Yeah.
Right? Because if you don't accept it, what are we solving? So
right. That's true. What are we working on if we don't actually know what we're working on?
Working on, I like that. Not solving, working on.
What are we working on? Yeah.
What are we working to improve? Right.
Yeah.
So I love it. Thank you so much, Dr. Carol. And thank you everybody for listening.
Yes. Thank you a million times. I really appreciate this.
Thank you. I'm grateful that you made time to be with us. I was looking forward to this, and I am glad it happened.
Ditto.
And, we may just have, the other stuff we discussed. We may have subsequent episodes. However, today we talked about trauma, and I hope and pray somebody benefited from this. It reached somebody. If you know somebody that could benefit from this, please share all the information with them. It'll only help. So thank you, everybody. Take very good care of yourselves.
All right? Yes. Thank you. Thank you. Be well.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.